Thank you for staying with us. You have been watching our latest segment of Conversations in Emerging Medical Technologies. I am Dr. Jonas Moses. With me today, Dr. Jennifer I. Lim from the University of Illinois Retina Center in their Eye and Ear Infirmary. We have been talking this hour about optical coherence tomography, OCT as it's known, and its uses in treatment of eye disease, especially in the retina, and upcoming in the near future, big forefront in glaucoma. And we were on a slide, and I wanted to allow you to finish talking about that slide. Can we bring up slide number 8 again?
Right. I was saying, actually, if you look at the slide, that the OCT is useful perhaps in helping to predict in patients with retinal degeneration what might happen in the future. That's what we're interested in looking at. And what we see here is that in patients who have retinal degeneration, the retinal outer layer is thin, the photoreceptor layer is thin compared to normal.
Right.
And these are seen even in patients who are already 20/20. They're 20/20, they have minimal symptoms, but they have known RP. We can do this test and we can see the thinning. And what we want to do is go forward and say, okay, if they're more thin, if the rate of thinning is slower, what actually happens 5 years down the road? So it'll be useful in perhaps following patients and making predictions. And then that being said, there are some new treatments out there that are experimental, such as, say, CNTF or neurotrophic growth factors that we can inject into the eye. And, you know, we want to see, does it actually help maintain the photoreceptor health and prevent that thinning? So the OCT is going to be useful.
Good.
Basically, again, giving us a live biopsy of that retina without actually having to section the eye, because you can't do that on a live patient.
Right.
Right.
No, I used histopathology earlier, and histopathological slide, that's a tongue twister.
Yeah, there you go.
Is a slide that's, you know, as you say, is from a tissue that's been taken in a biopsy, and it's been put in wax, and then do thin sectioning of that, and then you're able to look at it under a microscope. That's not useful in a patient.
Right.
We have to be able to image these things remotely without being invasive. And so I wanted to go back just briefly and talk about the next generation of the Fourier OCT, can you talk a little bit about that technology?
Yeah, there's several Fourier domains that are out there, OCTs. There's the OptoView, which, you know, this research I just showed you was based on.
Okay.
Then there's the Zeiss that's putting one out.
Yes.
There's one by
Was
Topcon.
the Cirrus, correctly?
Yes.
Yes,
And then there's the Topcon machine, and then there's a Spectralis that's an SLO OCT. Okay. So it does both scanning laser ophthalmoscopy as well as OCT. So there are all these new technologies. The bottom line is they scan fast, they give excellent images, and they're very useful for diagnosis as well as management of patients. And then frosting in the cake for us who are in research is that we can use them for research purposes.
And you do a reasonable amount of clinical research, is that correct?
I do, and I do a lot of clinical trials, and we're building that up at University of Illinois.
Are you allowed to talk about any of those trials right now?
Sure.
Okay.
Sure. Regarding age-related macular degeneration, we're working on the RADICAL trial, which is triple therapy, including photodynamic, anti-VEGF, and a steroid in various combinations. That's actually now open.
Okay.
I'm also doing a study on, well, that's just one of the AMD studies. And then I'm doing studies on diabetes. We're looking, as part of the DRCR network, on different anti-VEGF therapies, again, for macular edema, because it also is useful for that. And then one of my own pet projects is angioid streaks and choroidal neovascularization, and experimenting to see whether ranibizumab is an effective treatment in patients who are afflicted by that disease, because it frequently leads to blindness.
Angioid streaks, define, please.
It's a degenerative disease that occurs in a variety of medical conditions, but unfortunately when you get it, you get cracks in that layer underneath the retina, and it allows new blood vessels to grow in, and you get basically like a wet macular degeneration picture. And unfortunately, some of those patients are very young, and without treatment, it frequently leads to 2200 or worse vision. So we're looking to see whether anti-VEGFs help for that.
All right.
And there are a variety of other clinical trials that we're working on.
Do you work with other institutions in this, or with industry?
Yes, we do.
In fact, I just recall that you were going to be getting into the Zeiss machine soon.
Yes, we're going to be evaluating the Zeiss machine. They're bringing it for us to look at. We're looking at the OptoView also, in the hopes that we're going to purchase another Fourier domain. We have one already at University of Illinois, primarily for research purposes, but we'd like another one that we can use for diagnosis and management of these patients.
Of course.
Yeah.
And typically when you're working in concert with industry, are they bringing in their own technologists as well, or are you designing the clinical programs?
You know, that's an interesting concept. When we work with industry, they actually will give you some grants, and so you hire your coordinators, and we have excellent coordinators at University of Illinois that we've helped train ourselves.
Good.
And they help run the trials. Other trials, such as like the angioid streak trial, I can work with industry, I can write the protocol, and it's an investigator-sponsored trial. So it's up to me. I have to get the approval from the FDA for the IND, an investigational new drug device, basically, and run it from beginning to end. Other studies are known as phase 3, where the study comes into you, the company, and says, we've got this protocol, you know, can you give us input, yes, no, and can you actually run the study? Do you have enough diabetic patients that we can try this new drug on, comparing it to the standard, which might be laser? And we say yes, and we do those studies too. So there are a whole variety, and it's a really neat area to be in, especially in 2008, well, basically.
Dr. Jennifer I. Lim, thank you so much for joining us this hour. It's been an incredibly informative hour. We have been talking this hour about OCT, optical coherence tomography, and its uses in imaging and the management and diagnosis of disease in the retina and the eye, and soon to be in glaucoma treatment. You are watching In Time Television. You can always watch our archive programs by going to www.intimetv.com. When you are watching a live program, you can always join the conversation by sending an email to ask@intimetv.com. We do have someone monitoring that. If you want to ask questions, if you want to make a comment, however you'd like to join the program, just remember it has to be on the day that the program is live in order to join the conversations. You are, again, watching On the Edge, Conversations in Emerging Medical Technologies. And I am Dr. Jonas Moses. I'm happy to have had you join us this hour. If you are interested in being a guest on the show, please do write the In Time TV network. We're delighted to entertain any and all guests, and we can always do you remotely if you're from somewhere else in the world. We recently did an interview from Germany. So I encourage you to think about that. Please let us know a little bit about you. Thank you for having joined us this hour. Once again, Dr. Jonas Moses, On the Edge.